Hi, my name is Nikki and today I'll be doing a head to toe assessment. First I'm going to wash my hands. You do it 15 to 20 seconds. Dry them, turn the water off, and come introduce yourself to your patient. Hi Kelly, my name is Nikki and I'll be taking care of you today. How are you feeling today?
Good.
Good. Any allergies?
No.
Okay. And do you know where you are and what time it is?
I'm at New England Tech and it is 1:30.
Okay. If I could just check your name. Okay, could you tell me your name and your date of birth?
Kelly Suman, 11/29/88.
Great.
Thank you.
Okay. If you could come this way, we're just going to weigh you and get your height, okay? Okay, right this way, Kelly.
I just sit there and try to look who I know. I'm not.
You just step on the scale for me. Okay, great. If you could just back off. Okay, that way. Thank you. Okay, great. Step off, please. And your BMI is 22. Looking great. Right
Thank
this
you.
way, please. Okay, we're just going to check your gait, okay? If you could do me a favor and walk heel to toe. Okay, great. Now on your toes. Great. And now on your heels. Perfect. Okay, great. I'm just going to check your circumference, okay? Thank you. And there we go. Okay, great. All right, could you put your arms out for me? Rotate this. Okay, now flex them. Great. Okay, now we're going to shrug our shoulders. Wonderful. Okay, if you could just have a seat for me. Great. Could you push up against my hands? And the other one, great. And again with your legs. Wonderful. You could just grab my fingers and squeeze as tight as you can. Great. Okay. Patient's speech is clear and appropriate. Do you have any pain today, Kelly?
Nope.
Okay, great. If you could just puff your cheeks up for me. Okay, and smile for me. Frown, stick your tongue out. Left, right, up, down. Great. You could follow the light, please. Okay, now we're going to check your accommodation. Okay, if you could follow the pen light. Okay, great. And now just stare at the pen light as it comes closer and further. Wonderful. We're gonna just check your head, okay? Just make sure there's no bumps, infestations, or lesions. All right, looks good, all intact. Just gonna feel if you're warm. Okay, patient is dry and warm to the touch with the pink color. Okay, we're just gonna palpate her pinna, make sure that's okay. Do you feel any pain there?
No.
Gonna take a quick look in the ears. Okay, just gonna make sure there's no drainage. No drainage, we're gonna pick up and pull back to check the temporal membrane. Great. No drainage on this side. Back and up. Okay. And now if we could just check your mouth. Could you open your mouth for me, please? Okay, everything looks good. Teeth intact. Hard and soft palate appear good. Okay. Just going to check your irises. Okay, and they look good. Your conjunctiva is a nice color. Okay, and your sclera is nice and white, nice coloring. Okay, and now, if we could just check out your nose. Okay, nose is symmetrical. Okay, could you hold one side of your nose and breathe out? Okay, now do the other. Okay, great, that's good. Now I'm going to check the lymph nodes and to make sure the trachea is symmetrical. So we're going to start here and come all the way down, feeling round. Okay. Trachea is symmetrical. Okay. Now we're just gonna check your respiratory system, okay? Just gonna inspect, make sure her breathing is okay. All right, her breathing is nice and easy, no trouble, no labored breathing. Okay, now we're just gonna palpate. Any tenderness, any soreness? Okay, great. Now just because. Okay, all sounds are good. All right. Now we're gonna listen to your respiration. Okay. We're gonna listen to the 6 spots in the front. You could breathe in naturally. Okay, great. Now if you could just turn around so we can turn her back. Just gonna inspect her posterior tract. No cuts, no bruising. Everything looks good. Now we are gonna palpate. Any tenderness, any soreness?
No.
Okay, great. Now I'm gonna percuss. Okay, great. Okay, now we're gonna check the tactile furnace. If you could just say 99 for me.
99,
One more time.
99,
And one more time.
99.
All right, sounds good. Vibrations diminish as we go down. Now we're just gonna check. Okay, could you take a big breath in and out? And her lung capacity is within normal range. Okay, now we're just gonna listen. And we're gonna listen in all 10 spots. If you could breathe in and out for me. Okay, great. Is that it for that? Okay, if you could turn back around for me. Just gonna lay down, thanks. Okay, all right. I'm gonna check her Babinski reflex. Okay, and the other one. And looks good, negative. Okay. And now we're gonna do the assessment of the cardiac cycle. Okay. First, we're gonna place the bed in the correct position. We're gonna raise the patient up to our hips, and then lift the bed to a 45-degree angle. I'm gonna check the carotid artery. Okay, one time at a time, one side at a time. Okay, if you could turn your head to the right, please. Now to the left. We're checking for the jugular vein. We're making sure there is no protrusion of it, which there is not. And now we're going to listen to root within the carotid artery. And no signs of root. No swishing. Everything sounds normal. Now we are going to assess the heart sounds on the 5 valves. We are going to start with the aortic valve. Now we're going to go to the pulmonic valve. Now to the Ebbs point. Bicuspid, then mitral. Okay, now we're just going to check her GI system. Okay, have you had any nausea or vomiting lately?
Nope.
Okay, great. Just going to put the bed down and then lay her head back so she's laying flat. Okay, first we're going to inspect the abdomen. It looks nice, it looks flat, no cuts, no bruising. Okay, everything looks good. Okay. Now we are going to listen to her bowel sounds. Start with the right lower quadrant. Moving up. Okay. And then we're gonna go over. And then the last one. Okay, sounds good. A little gurgling. Everything sounds normal. Okay. Okay, now I'm going to percuss her abdomen. Okay, everything sounds great. Now we're just gonna palpate lightly. Any pain? Any soreness?
Nope.
Okay, now we would go into a deeper palpate, but we don't do that for the video. Okay, that's great. Could you just sit up for me, please?
Sure.
Thank you. Just gonna lower the bed. Okay, could you stand up for me, please? And turn around. Okay. All right, if you could just bend over for me. And now we're just going to check her back for any curvatures, any lordosis, scoliosis, kyptosis. Okay, looks good. If you could get back up, please. All right, could you put your arms out and close your eyes? Okay, great. The Romberg test, she did great at. No swaying, no collapsing. Okay. Well, thank you very much, Kelly. I believe we're done.
Thank you.
Have a good day.